Hello, these are flipped notes 8-2, and in this section on clinical psychology, we're talking about anxiety disorders, OCD, and related disorders, including stress-related disorders. Let's get right into it. So, how common are anxiety disorders? Anxiety disorders are actually the most common of diagnosed mental illnesses. Most common mental illness in the US, about 18% of the population every year. And in adolescents, about 31.9% could have a diagnosis of anxiety disorder based on using DSM-4 criteria. We mentioned this a little bit in the last section, that the way anxiety has been categorized between the DSM-4 and the DSM-5 has changed. Now, anxiety includes generalized anxiety disorder, panic, and phobias. And then the obsessive compulsive disorders have their own whole category because there's so many more of them now, so much more information. And trauma and stress related disorders also have their own category. So, in general, anxiety disorders, you feel anxious. What does that mean? There's worry, fear, apprehension, intrusive thoughts. That's a big one. You just can't stop thinking. Sometimes your thoughts are a stream, the stream of consciousness, like William James said. Sometimes it's a raging river and it just won't stop. Physical symptoms of feeling tension. And it all seems to have sort of an automatic quality that comes from within the person that you can't control it. It's like a knee-jerk, uncontrollable reaction. We've got GAD, PD, and phobia disorders that we'll talk about here. So generalized anxiety disorder, commonly abbreviated as GAD, though I would say people don't go around saying GAD. Usually they just say anxiety, is an excessive fear, dread in response to a real or imagined danger. So in a lot of cases, it's something that's not really dangerous, like it's not going to hurt you, but that fear of it is still very much anxiety producing. That fear is out of proportion to the situation. It's prolonged. So it's pretty much all the time. It's kind of vague and unexplained, but it can still be intense. But it's not attached usually to any particular object. That's where a phobia would be identified. Study shows that between 4 and 6% of the population, that's a lot of the people, seems to be more common in women than men, and it starts to show up a little bit more in late teens and early 20s. Other symptoms, clinical features that might be identified in the DSM-5, that anxiety and worry should be lasting for at least 6 months or more. You can't control the worry. It's considerably distressing. There's that one of those key words. And impairments in social, occupational, or other important areas. So, really, a lot of anxiety about talking to people and worrying about it. What do people think? What do people say? And then panic attacks happen. Not all the time, but panic attacks can be a symptom. And then the DSM-5 says there has to be the presence of at least 3 or more of these and some other symptoms as well. But restlessness, you're easily fatigued, and it's because of that mental exhaustion from worrying so much. Difficulty concentrating, irritability, muscle tension, because we tend to hold our stress and our worry in our shoulders, and then sleep disturbances because you're worrying, so you can't go to sleep. That continuous thoughts, and I put it in here, is also called ruminating, when we're just worrying, continuously thinking about things. Panic disorder is in this category as well, and it shows up very similar as generalized anxiety, except there's much more frequency of panic attacks. It does seem to be more common among women and younger people. The clinical features, recurrent unexpected panic attacks that are lasting for more than a month, not one panic attack for a month, but they're happening over time consistently for a month or more. And then the thing about having a panic attack is once you have one, you really start to worry about having more of them. And that kind of puts you in this bigger cycle of worry. Lots of things happen during a panic attack, and they can look different in different people. Generally, you have a hard time breathing, and it's more like you're hyperventilating, like you're breathing in too much. And that's why in the previous picture, the lady had a bag over her face, is because that can be something that kind of stops it, is that you're trying to keep yourself from breathing in too much air, excuse me. Feeling of being smothered. Sometimes you feel dizzy, trembling, shaking, sweating, which is just a general symptom of generalized anxiety disorder as well. A racing heart. Lots of people have called 911 thinking they were having a heart attack. When they hook them up and the EMTs get there and they're looking at their heart and everything, they realize it was a panic attack. And people sometimes feel embarrassed about it, but it's nothing to be embarrassed about because they look very similar. Nausea, a lot of people need to puke, sometimes bathroom issues during a panic attack, numbness or tingling, and you feel like you're gonna pass out. Sometimes it feels like the walls are closing in. Chest pain, you just feel like it's strange, like something is just not right. Like, and it's just this sudden, overwhelming dread. Fear of going crazy, losing control, or dying. The duration can vary. Sometimes it's a few minutes. Sometimes it can last for quite a while. And a lot of times that people feel very exhausted because you just had this mental overload. Usually with a panic attack, a lot of hormones and neurotransmitters are being released. So once it starts, it's very difficult to stop it, and you really just have to ride it out. Sometimes you can cope with it, like recognizing symptoms that are bringing it that show that a panic attack is about to start, and then try to cope with it and stop it. But once it truly starts, it's really hard to stop it. And just telling somebody, calm down, they can't. They've just got to kind of get through this, and then they'll be better afterwards. All right, phobia disorder is our next one in this category, and this is kind of the opposite of generalized anxiety disorder because here, people who have phobias know exactly what they're afraid of, but their fears are out of proportion with reality, seem unexplainable, they're beyond their voluntary control, but it's usually focused on an object or situation that disrupts their behavior. And again, we all experience fears of things, but it doesn't become a disorder until it's distressing, dysfunctional, deviant, unjustifiable, and dangerous. So on here, the blue on the left showing, these are common fears, but then how many people also see them as phobias. A few specific ones or a few types of phobias. So a specific phobia is a fear of a particular object. And we'll look at the phobia list in class, but there are hundreds, if not thousands, of different types of specific phobias. A couple categories. Social phobias have to do with a fear of embarrassment and interacting with others. There's other ones that are common, like fear of heights and snakes. Those are real common. And then agoraphobia, usually it literally means fear to go to market, but it's a fear of entering certain unfamiliar situations, usually as panic attacks. But generally, we say it's like a fear of public places. So they want to avoid crowds where attacks could occur. Our next category are the obsessive compulsive and related disorders, with OCD being the main one there. OCD has two main components, the obsession part and the compulsion part. And it is actually possible to have just one or the other. There's also obsessive disorder and compulsive disorder, but more commonly they show up together. But the obsessions are the unwanted thoughts, I can't control it, like consistent worrying. And then the compulsion are the senseless rituals, having to do something usually to soothe that thought. And the rituals can also cause distress if you don't do the rituals exactly how you want them. So it's kind of in this continuous cycle. You have the obsession, the intrusive thought, which causes anxiety or stress. You do the compulsive ritual like cleaning or counting or checking something, and that brings relief. But the obsessive thought comes back, and you go into this cycle again and again and again. People with OCD people with OCD do not seem to know anything with certainty. Like they don't know if they locked the doors. They don't know if there's germs on that. They don't know if something bad is going to happen. So they do these things, these compulsions and rituals over and over again to find a sense of relief. They don't trust their own decision making. So when it comes to what could be a biological cause of this, where does decision making happen? In the frontal lobe. So PET scans show that people who have OCD have higher than normal activity in their frontal lobe involved with directing attention. So they're constantly trying to make decisions over and over and over again, but they're not really trusting their responses. Okay, OCD related disorders. There's several here, but I believe the only one that's actually in our College Board AP curriculum is BDD. So I'm going to come back to that one in a second. Hoarding disorder. You guys probably know what hoarding is, but the big thing there is that they're distressed about getting rid of or discarding items, possessions, because they have a need to save them. Trichotillomania. I don't know if you know the word, but you may have heard of this, but that's a hair pulling disorder. Not just like hair on your head, but your scalp, your eyebrows, other areas of your body. And they want to stop, but they can't. And then I can't say this word, excoriation disorder is a skin picking disorder. But to the point, I mean, some of us like pick acne and stuff. That's normal. But picking to the point where you have lesions and they get infected and it becomes distressing and it's dysfunctional because you can't leave home without an hour of doing it, then it becomes a disorder. Body dysmorphic disorder, we talked about a little bit in previous chapter with eating disorders because it's usually co-concurring. Co-concurrent means you have more than one disorder at a time, but they're preoccupied with an imagined or exaggerated defect in their personal experience, and they picture or they over picture things about their body. It can be time consuming, sometimes about the shape and size of facial features, acne, wrinkles, their hair. Sometimes it can be about body weight, but they are very distressed over it. And often they see things in a much more exaggerated, dysmorphic way than what it truly is. People who have BDD also have higher rates of major depression and suicidal tendencies, and it's equally found in males and females. Our last category here in this section are trauma and stress-related disorders. Again, these used to be part of the anxiety disorders in DSM-5, but now they have their own category. PTSD, post-traumatic stress disorder, 4 or more weeks of the following symptoms. So this, we often associate PTSD with combat veterans. In the old days, they used to call it shell shock, that soldiers would come back from war with these symptoms, and it was shell shock. Now we know that PTSD can happen from anybody who's faced a traumatic event. So victims of rape and assault, survivors of disasters, any kind of event that causes trauma. But after a month or more of these symptoms, then it can be diagnosable. Haunting memories, and usually very vivid memories, nightmares and flashbacks. Flashbacks are kind of a hallmark symptom. Social withdrawal because of that, very jumpy anxiety, and lots of sleep problems. A lot of the newer research is suggesting that people who have PTSD have problems with their body's arousal and their fight or flight response not being able to turn off. And they're getting continuous releases of cortisol. And we know that is the stress hormone, and that's putting them in that fight or flight mode continuously. But something needs to be said too about the resilience of people. Not everybody who experiences a traumatic event has PTSD. Only about 10% of women, 20% of men react to traumatic situations with PTSD. That is still a large number of people. But a lot of people we have resilience and we're able to bounce back. And our mind is amazing in its ability to do that. Acute stress disorder is similar to PTSD, and this is kind of a new add to our AP curriculum, but it starts immediately after the trauma and lasts from 3 days to a month. The PTSD, well, let me just say this. The PTSD tends to have more dissociative things like reliving the trauma, and then acute stress, it doesn't quite have that as much, but they kind of feel numb and negative and moody. So this one has probably a lot closer to more of a mood disorder. They don't have as much of the anxiety in it. So these were all previously considered anxieties, but not all the patients who were experiencing this were actually having anxiety. Rather, PTSD may show up as anger and aggression or dissociation, where they kind of lose touch with reality. And that has put them into their own category. So we're going to look at a little bit of the causes. Etiology is our big word that means causes of disorders, and we'll talk about these a little bit more when we talk about therapy and treatment. But looking at anxiety and the other ones in this section, the learning perspective suggests that our fear conditioning leads to anxiety, that we've learned it because of some kind of bad experience, but also through observational learning. The biological perspective says that generalized anxiety disorder, panic attacks, OCD, all have to do with brain circuitry in the cortex, but also issues with neurotransmitters. And the way we can tell that there is a biological connection here is that medication works for these. And that's one of the good things about all these disorders is that there is a lot of different medications out there that work, along with different types of therapies. One of the neurotransmitters that's really connected here with anxiety is GABA. You'll recall that GABA's job is to calm you down. So those with anxiety disorders may be having deficiencies in the amount of GABA. So GABA different medications like Valium are trying to increase GABA, inhibitory activity. So getting GABA to stop the neurotransmitters from firing. Cognitive factors, focusing too much attention on perceived threats, misinterpreting harmless situations, only having selective recall of the negative stuff, threatening stuff. I'll talk about that story in class. Personality, having a neurotic personality type. We've taken the personality assessments, but they're more self-conscious, nervous, just jittery. And then, of course, stress. Positive correlation between high stress and anxiety. All right, that's all of it for Flipped Notes 8-2.